So, hi everyone. Panos here from PNOE, and in today's webinar, I'm very delighted to have Okon, one of our valued affiliates who has done a lot of work in the recovery space using PNOE, along with many other modalities that can help with recovery. Okon has been a long-time PNOE user, has had a lot of experience using our system and metabolic testing in a wide range of customers. But today we're going to focus specifically on recovery and, how the information from the test can help inform one's recovery program. Okon, it is great to have you in today's webinar. Thank you so much for joining me. Over to you. Why don't you tell us a little bit about your background, the type of business you're running, and the type of work you're doing?
All right, everyone. Thanks for having me, Panos. My name is Dr. Okon Antia. I am a physical therapist and a sleep, stress, and recovery certified coach. Uh, I've been utilizing the PNOE device for about a year and a half now. I came across the device at one of the national conferences at the one of the national conferences, uh, CryoCon. So I had a chance to check out a lot of devices and meet a lot of people. And the PNOE device and the system caught my attention due to a lot of the stuff that we offer and a lot of the benefits of data analysis and metabolic health that helps inform us on our decisions on what routes we take to help people optimize their health. And so my practice is down in the greater Houston, Texas area. We have two locations. One of them is a partnership with Anytime Fitness, and the other one is a standalone location. We offer the metabolic testing at both facilities. We we like to consider ourselves, although I'm a physical therapist and we do offer traditional physical therapy services, we like to consider ourselves a health optimization and wellness center. And so we help people with different aspects of health, including their sleep health, their brain health, their metabolic health, their movement health, and what we're talking about today, recovery health, which basically encompasses all the other aspects into an overarching uh, health message. So, to that end, we offer a lot of different services, testing, uh, technology, different things to accomplish those main overarching goals. And so we've got our facility kind of divided up into three different labs. We have our rehab lab, which is our physical therapy, sports medicine. We have our performance lab, which encompasses PNOE for VO2 max testing, resting metabolic rate testing, and we do 3D motion capture as well under the performance lab side. And then the recovery lab, that's where we focus on, we have whole body cryotherapy, we've got whole body red light therapy, we've got PEMF therapy, we've got all the compression boots and massage guns and all the like. So that's kind of how we're set up. And PNOE's been integral in kind of tying a lot of it together, because when it comes to client success or setting people up on a plan as a PT, we would always start with an evaluation, assess the patient's goals, where they want to get to, where they're at now, and then we're demonstrating progress to those goals, visit to visit, week to week, etc. And PNOE gives us a chance to provide that same assessment up front, and then also track progress over time, and how different strategies, whether it's nutrition or exercise, how those different plans can affect your biometric health moving forward. So yeah, that's kind of the long and short of what we do, kind of why we do it, and how we came to be on this webinar here today.
No, thank you so much for this background information. It's always helpful for interested people to understand what others are doing in terms of modalities. Do you mind if we get into a little bit more detail around specifically the types of recovery modalities that you use, but then also what kind of improvements have you seen by utilizing PNOE's biomarkers in evaluating the positive impact that these recovery modalities have on patients? And obviously, if you have specific customer success stories to share, and they can also be from various different types of audiences, right? I don't know if you focus specifically on athletes or on older people. If that would also be very interested in knowing.
Okay, so from a recovery aspect, so a lot of times we're using, we do see athletes, and then we do see kind of our weekend warriors, kind of older adults. We work with a lot of runners, a lot of fitness folks that are 40, 50 plus, that are just trying to increase their longevity, or get themselves feeling better, sleep better, eat better, handle stress better, all these different aspects of being a better version of themselves. And basically what we come to find is when people are lacking energy, or they're always fatigued, or they have high levels of stress, they're always on the go, what we find is they aren't recovering well. And that lack of recovery can be a lot of different reasons. It can be a lack of sleep. It could be lack of proper nutrition. One thing that PNOE helps us identify is people usually aren't eating enough, or eating as much as they should be eating. A lot of online, a lot of people do a lot of research into like how many calories they should be eating, and if they should be eating carbs or fats or proteins, and how much, etc. And what we find is, once we run the resting metabolic rate test, and it gives us our caloric intake needs, a lot of people aren't eating anywhere close to the needs of what they have. And so being able to identify that on a test, and show people that your body actually needs 2,200 calories, because this is what you burn at rest, this is your activity level on days you work out, these are your activities of daily living, this is your total energy expenditure, and you're trying to build lean muscle mass, or you're trying to lose weight, or you're trying to burn fat, and you're not powering your body enough to repair the processes, to power the processes that you need for repair. And so we find that people aren't eating enough. And then, we've also got folks that have been chronic dieters, and so they're just used to like restricting calories and cutting calories. And so you're going to have a hard time repairing your body from damage induced by exercise if you're not eating enough calories to power the metabolic process of anabolism, which is building. So it takes calories and energy to build muscle, and it takes calories and energy for your body to burn fat. And so people are wanting certain things, but they're not realizing what's needed to do that. And having the test and being able to show the reports on, this is what you need, and then complementing those things with with technology and modalities that help boost the body's natural processes. And so that's what that's what PEMF therapy does. That's what red light therapy does. That's what cryotherapy does, is it helps take processes that your body normally undergoes and gives them a boost. And so, it's a turbocharger, it's a boost, it jump starts the process, it enhances your own efforts. When you're, younger, when you're in your, when you're in your teens or your 20s, and your cells repair and regenerate much faster than when you get older. And so you have to supplement the fact that your body's going to slow down the metabolic process by dialing in your nutrition, dialing in your sleep, using modalities and technology to enhance the process of metabolism and regeneration, and oxygenation and circulation to your blood and to your tissues. And so when people think that, oh, I'm getting old, I need to stop doing these things, it's not that you're getting old and that you can't do them. It's that you need to be more dialed in to the processes of getting your body to where it does function and perform like it did when you were in your 20s. And lining up everything, that's exactly what you need to do, because the aging process, without taking action, the aging process will cause you to heal slower and to put on weight. And so you've got to, as you get older, you've got to take advantage of the opportunity to identify where your stress points might be, and implement strategies to address those. And so throughout the continuum, you run a VO2 max or an RMR test, and then 3 to 6 months later you run another one. Each time you run the test, you can rearrange the plan to you can reimagine the plan or the strategy to optimize where you are at any given point. And a lot of people, when they start their health journey, it's very easy, if you haven't been doing anything, to just do something and get results. But as you get further in, you've got to be more strategic about what you do and don't do, so that you can keep getting results. And a lot of people get stuck and get discouraged when they get to a certain point, because they're not seeing the results. And it doesn't mean that you're a lost cause. It just means you've got to be more strategic in what your next step is. And so that's what having the data available and doing the performance testing and utilizing the technology and the modalities, that's where it helps you. Is it gives you that opportunity to keep making tweaks to the plan and keep updating it as you continue on your health journey.
Totally. You know, we do a lot of work with clinics like yours that have PMF as a core part of their offering. We are also, work closely with Pulse in certain of the, deals that we're working on. And I don't know what type of device you're using for your PMF, but it would be very valuable for the audience to kind of share your experience around the positive impact that you've seen using PMF as a recovery modality, and perhaps the reflection of these positive impacts in any of the PNOΗ tests you've done.
Okay, so PEMF therapy is it's a very versatile technology. it helps a lot in, all the way from the medical PT pain relief side, all the way to the sleep, stress management, and recovery side. And so as a PT, PEMF helps with, chronic pain and, arthritis symptoms, any kind of, autoimmune whole body type of things where normally you might be put on pain medication for for eternity, or you might be seeing a pain management doctor and having to get injections, every 3 months, every 6 months, etc. PEMF helps with, osteoporosis and osteopenia. So if you're having problems with building bone or losing bone, PEMF helps improve your body's ability to form bone, which is another reason why it's used in technology for fractures and non-healing fractures, or fractures that we want to speed up the healing. PEMF technology is used for fractures in bone as well. And so from a medical perspective, there's a lot of benefit from it that you can use in conjunction with any other treatments that you're doing. And then on a recovery aspect of it, PEMF helps with stress management, relaxation. So it helps with sleep improvement. PEMF works by frequencies. And so the way that your body kind of utilizes it is each frequency speaks to a different type of cell in your body. And so there are certain frequencies that speak to certain cell types and conditions that you have. And so PEMF is very versatile in that you set it to a frequency and you can expect some improvement with anything that speaks to that same frequency. So if it's a 10 hertz, there's a lot of conditions that it can assist with that are, at a 10 hertz or 9 hertz or 12 hertz. And so you may get a primary goal that you're trying to accomplish, but you will also get benefits from everything else that works at that frequency. And from a PNOE aspect, PEMF helps with your fat burn efficiency. So one of the main metrics that we get from the PNOE report are the fat burning efficiency. And that's essentially what your body is burning at any given time from the calories you burn. Are you burning fat calories, or are you burning carbohydrate calories? Obviously, if you're burning fat better, you're able to stay leaner because you're burning more fat at rest versus burning carbohydrates. You're utilizing oxygen better because fat uses oxygen to metabolize. So if you're able to metabolize oxygen better, burn fat better, your cells are going to be healthier. And so the fat burning efficiency score is one metric that we've seen improve through the use of PEMF from one test to another test. And so it also helps with, recovery capacity. So that's something that we can test via the VO2 max, the active metabolic rate VO2 max test. Your body's ability to recover after a vigorous workout can be measured via the PNOE breath analysis, and we've also see that improve over time, meaning your body's better able to utilize oxygen, better able to recover after workouts, after training, and gets you ready for the next training session, gets you ready for the next game or the next race. And so yeah, it's very
And it's
versatile in many different ways, from health, from health and wellness, all the way to sports medicine.
And it's important to note that fat burn efficiency as a marker is very closely connected to the recovery capacity that is measured in the VO2max test. What we do measure in the recovery capacity score in the VO2max test is how efficiently your body is going to clear fatigue metabolites, which are expressed through excess CO2 in your breath, right? When you build up a lot of these fatigue metabolites because of like an intense bout of physical exercise, you're going to start producing more CO2. And so the faster you can clear that out, the more able you are to recover. And the benefit of having more mitochondria and more capable mitochondria is that you can clear out these fatigue metabolites more effectively. And at the same time, however, more mitochondria and more efficient mitochondria will also translate to higher fat burn efficiency. And that's why, it's mitochondria ultimately and better mitochondria that connect a better fat burn efficiency with a better recovery capacity. Okon, based on what you're telling me, is that PEMF has produced positive results when it comes to fat burn efficiency, but also positive results when it comes to recovery capacity. How many sessions do you typically recommend that people take in order to start to see these types of benefits?
For our health and wellness plans, we like to see 3 months of regular use to see significant change between metrics. So you're going to see improvements, within 2 to 4 to 6 sessions, but to see the improvement across measured metrics, 3 months to start on a regular pace. So 2 to 3 times a week for 3 months. And then after that, you can kind of, depending on where you're at and where you want to go, you kind of tweak the plan. But we always want to start off with 2 to 3 times a week, utilizing the technology in conjunction with habit and behavior change. So, taking out things that are working against you, adding in things that are working for you, whether that's, nutrition or schedule, or, make modifications to controllable variables that you can. And so the technology is a piece to that puzzle, but we want it to be kind of a comprehensive thing. And so you've got the technology, but we've also got the, what you're eating, when you're eating, are you eating enough? Are you eating the right stuff? And which is another thing that that the PNOΗ helps us with, as far as the nutrition plans and, identifying, healthy carbs, and so that you don't have to restrict carbs, you just eat certain kinds of carbs, or healthy fats and things like that. So we incorporate all of those things into a plan, and we like to see that plan go for 3 months to really hone in on what worked, what didn't work, and what needs to be modified. And if you don't give things a chance to work, then you won't know if it worked or not. And so so we like to start with 3 months on a lot of these plans, and go from there.
Totally. No, that makes sense. And the 3-month cadence is something that many other affiliates also apply. It is a good time frame, especially if you're applying some sort of mild intervention, like, having someone visit your facility 2 or 3 times a week, plus some sort of nutrition and training program. If you get this level of commitment from someone, then 2 to 3 months is a reasonable time frame in which you can expect to see results. Obviously, and maybe you can talk about specific cases along these lines, but if you have someone who's like much more dedicated or much more serious, because let's say he or she's an athlete and they're not just doing 2 or 3 times a week, they're coming like 5 to 6 times a week, then there is perhaps the ability to shrink this window of foreseeing significant changes to maybe say 1 to 2 months. I don't know if you've seen any such cases.
Yes. So usually we would measure every 3 months, but
Mhm.
what you tend to hear in
Mhm.
the intervening time is, people are sleeping better, they feel better, they have more
Mhm.
energy. So those subjective reports of what you were feeling before and what you're
Mhm.
feeling now, you will start
Mhm.
seeing that within
Mhm.
a month,
Mhm.
within a month to 2 months. You'll
Mhm.
see that within the weeks,
Mhm.
because a lot of what is causing some of these issues with
Mhm.
folks are, um, a lot of it is our diet, and a lot of it is our schedule. And when I
Mhm.
say diet, it's not necessarily that you're eating bad stuff, it's that you're not eating the right amounts of the right stuff. Okay, so
Mhm.
it's easy to say, you know don't eat fast food or junk food or processed food, but there's a lot of people that don't eat any of those things that still aren't fueling properly. And so identifying what your fueling needs are. you
Mhm.
know the body needs energy for your lungs to function, for your heart to function, for your kidneys to function. And if
Mhm.
you've been chronically deficient in the energy that you provide your body, you're not going to get 100% kidney function if you don't have enough calories to power your kidneys, or power your heart to pump, or how power your lungs, right? So if everything is sluggish because it's not getting enough energy, it's not going to perform at full tilt. And so
Mhm.
we have to, think, instead of just thinking of calories and calories out, we've got to think about metabolism as a proactive process. And you've got to, at minimum, power the body's ability to do what it's there to do. And if you're just chronically uh, under eating, you're gonna see your body start to use less and try to get by on less and less. And so it's gonna start uh, shutting down processes, or making them less efficient than they would normally be. And so, uh, you know, nutrition helps with that. But with the PEMF, or even red light or cryo, some of these other things, it does help your mitochondria become more efficient. Uh, you increase the amount and the efficiency of your mitochondria. You increase the use of oxygen for the cells, because the oxygen is used by the mitochondria to generate more ATP. And so, now you're able to get that full night's sleep and wake up in the morning and feel energized, because your body is producing more energy. It's producing more energy from the food you're eating, and it's producing more energy from, uh, supplementing your cellular processes. And so, you know, if one thing that people should take away, if nothing else, is that everything starts with the cell. And that goes for pain and injury and tissue regeneration, fractures, you know, torn ligaments, tendonitis, muscle strains, anything that you can think of on the injury side, all the way to, how well you're burning fat, and how many calories you burn at rest, and all these different things. It's all about the cell. And so hopefully folks are realizing that cellular health, how important it is, and digging into the importance of putting your cells in the best environment to thrive and do what you want them to do. When you're a kid, or when you're in your 20s and you're a young adult, your cells are going to perform more ideally. And then as you age, there's going to be a process that kind of slows some of that stuff down. And so you've got to supplement those things if you want to keep being active and have a longer lifespan and health span. You've got to do things to repair your cells and get yourself to heal faster. And you know, it's a comprehensive process, but having tools like PNOະhelp you identify certain things that you can work on in a certain amount of time to address, and then maybe shift to the next thing if you can't implement a full plan that changes 5 or 6 different factors at one time. Maybe you can choose one thing to focus on now. Whatever you identify as the main culprit, you can start there, and then as you move forward, you change your strategy to address other things. So maybe you're not sleeping, your nutrition's poor, you're very stressed out, you've got 2 or 3 injuries that have all cropped up at the same time. So you got all these things going on, and maybe it might be too much to try to address everything at one time, but you start identifying what to tackle first, and then you move through the process by handling everything else. And so instead of playing the guessing game or just Googling like maybe what you should be doing, it's always going to be better to have data and have a plan, and then be able to retest after a particular amount of time.
No, this is super helpful. We have a question from the audience. What kind of PMF device do you use, and do you have any recommendations for what to use? Like, what has your experience been with PMF devices in general?
I would say I've used a couple different types. I mean, I've got a mat, a full body mat. I've also got localized devices. So the localized devices are more joint related. So like if you're dealing with somebody that has like maybe knee arthritis, and they're trying to avoid having a knee replacement, and they've done injections, and they've done the anti-inflammatories, and they're looking for another option to either avoid the knee replacement or delay the need for one. There's localized PEMF devices that would go right around the knee, or it's you fractured your ankle, and whether you've had surgery or not, you're trying to get that bone to heal. You want it to heal faster. PEMF technology helps with that. So the localized devices are going to be more used in an orthopedic way for fractures, or tendonitis, tissue healing, those types of things. The full body mat is going to be something that's going to do more with your metabolism and your sleep and your relaxation, stress management. You're laying on the whole body mat to get that effect. And so it just kind of depends on what you're trying to help or assist with. And when it comes to like which device to use, I would recommend just doing demo calls with different providers of the devices to see, what they have to offer, what questions they can answer for you. And yeah, it's not as important at who you choose, because you got to choose whoever you're comfortable with, whether it's the service that they provide, or the cost, or et cetera. And it's more about the application of it. When are you using it? What are you using it for? And what are the outcomes? So I would say, focus on what it is you're trying to accomplish with a particular client utilizing the PEMF, and then kind of take it from there. Like, who are your clientele? Are you working with athletes? Are you working with weekend warriors? Are you working with some adult fitness folks? Are you working with, elderly that, maybe they're worried about dementia or Alzheimer's or, different things. So look at who you're dealing with, who your clients are, and then try to target technology interventions that assist them on whatever health journey that they're on.
Totally. And I think this is a very interesting angle. I've been in the space for quite some time. I mean, breath analysis and longevity at large, but not specifically PMF. But this understanding that you shared, which is not so much about the manufacturer, but it's more manufacturer X application. So depending on the type of work that you're doing and the types of clients you're dealing with, different solutions in terms of the PMF device could be a better fit for you. So I think that's, valuable to anyone interested in going down this direction. I don't know, folks, if you have any other questions, since we have Dr. Okon here with us. Besides additional questions, Okon, if you have any other things you would like to share with people.
Yeah, I mean, I would say that these days, everybody's looking for, quick fixes and the next magic pill, the next magic bullet. I would say when it comes to your health and wellness, there is no magic pill. There's no magic bullet. I deal with this on the PT and rehab side, but we also see it on the health and wellness side as well, where, people wait for a problem to get really, really bad over a long period of time. And then all of a sudden they want it fixed like next week. And the body just doesn't work like that. Unfortunately, the longer that you've had the longer that you've had an issue, typically the longer it's going to take to resolve it. And so if you've had, pain in your Achilles tendon for 5 years, your Achilles tendon pain is not going to go away in 2 weeks. Like, there's a process that has to undergo. And it's the same with if you've been, chronically under eating or overeating, or if you've been, eating the wrong things. It's a process. And so, I would just encourage people to, play the long game, avoid cheap tricks and shortcuts. Try to think of these things as a lifestyle change or lifestyle improvement. You don't have to be perfect and do everything 100% perfectly for eternity. Give yourself some grace, allow yourself, follow the 80-20 rule, try to do the right thing 80% of the time. And then, it won't bother you so much if you have slip ups or missteps, because you've got a 20% wiggle room in it. And if you can, follow the 80-20 rule, then you're going to be more successful than not in whatever type of health optimization journey that you're on. And so I would encourage people to, play the long game, do the best you can with staying consistent, because consistency is everything. And, when people don't have success on their health optimization journey or their physical recovery journey, it's usually because they lacked consistency and, quote unquote, fell off the wagon and stop doing whatever it was that they needed to be doing. And so just try to stay consistent. Keep in mind the goal that you've set. You know, if it's to gain lean muscle mass, or it's to burn fat, or it's to lose weight, or it's to, you know, have more energy and sleep better, or if it's to, you know, clear the brain fog, all these different things. There's a lot of different things that we can accomplish. A lot of these processes and conditions all stem from the same place. And so, you know, there might be little variations in what we do to help assist with those different things, but it all boils down to the cell. It all boils down to metabolism, and it all boils down to recovery. And your recovery and your recovery response has to be equal to or greater than your stress and strain response. And, you know, I want people to understand that stress doesn't always just mean like you're worried about, you know, your kids or your job or work. Like a lot of times exercise is a major stressor as well. You know, running marathons and competing in triathlons, those are stressors. They're positive stressors and stressors that you like and feel good about, but they're still stressors to the body. The body is going to view a good stressor and a bad stressor as a stressor, and a stressor needs to be recovered from. And if that stressor isn't recovered from, even if it's a happy, beneficial uh, stressor, like relieving stress because by running or lifting weights, if you do too much of it and you don't have the recovery process, it'll turn into a negative one, which is, you know, pain or, you know, lack of performance moving forward. Uh, so so whether good stress or bad stressor, they're all stressors, and they need to be balanced with recovery. And I know recovery sounds boring, and, you know, people are like, this kind of stuff, but, you know, recovery is encompasses a lot of things, and it encompasses sleep. You know, it encompasses relaxation. It encompasses nutrition, and you know, it's multifactorial. And you know, a lot of times when people get stuck in their training, the problem is not that they're not on the ideal training plan or exercise plan. A lot of times the problem that the lack of breakthrough is due to the lack of recovery, and you're not resetting your body's ability to maximally perform the next time you want to perform. And so recovery makes it so that the next time you perform, you can give it everything that you've got, and you're not starting off with a deficit. So that's where the importance of recovery comes in. And, you know, that can take many different forms, as I stated earlier.
Awesome. No, thank you so much for all of these wonderful insights you shared with us, Okon. And you know, I'm sure there's going to be a lot of people who are going to watch this webinar, the recorded version of it, especially those who are looking for, you know, some sort of PMF solution for their clinic. We are in the works of doing some research and, you know, some collaboration with Pulse PMF, which is one of the leaders in the PMF space, that ended up becoming sort of like an organic evolution due to the fact that we have a lot of customers in multiple different sectors, from IV lounges to recovery clinics, that use both PNOE and Pulse PMF. If you want to learn more about, you know, special offerings, or, you know, the type of work that we do in PNOE, or, you know, how specifically the metrics that Okon discussed can be influenced by PMF, and dive more into the science, we added a few links here that you can use in order to schedule a call with someone from our side who can dive into the details a lot more. This time I just wanted to thank you, Okon, first of all, for spending some time with us to discuss all of these wonderful insights, and obviously thank everyone who participated in this webinar. Okon, I hope to see you in one of the upcoming trade shows. I know we're doing a lot. I'm obviously not attending all of them, but I'm sure I'm going to be in the big ones. I don't know if you will be in A4M in Vegas. If you are, I'll be there. Otherwise, I may catch you in one of the other shows.
Sounds good. Good to see you.
Awesome. Thank you.
Thanks
Thank you
for
so
having
much.
me.
Yeah. Thanks, everyone.